Hello everyone, I'm Dr. Ismail Nejad, and in this video we want to talk about how to examine a patient before rhinoplasty. Okay, before starting rhinoplasty, it is really important to examine the patient carefully. It is important first take the history about the different problems, the medical conditions, also the allergy, and after that we examine the patient very carefully, and finally we assess the CT scans which we present in the previous video. So in this video we want to talk about how to start the examination and how to go step by step for a complete examination of the patient. Okay, in the first step, I check the symmetry of the nose. So I try to evaluate that from the front, also both sides, and below the nose, and also above the nose. We call that the worm's eye view and also bird's eye view. I check for any asymmetry, any skin irregularities about the nose bridge, the nostril asymmetry, the tip deviation, the septal deviation, and the bone defects or any problems there. So that is the first step that you should evaluate about your patient. For the second examination, I try to check the thickness of the skin. In the patient, if the skin is very thin, so it is a difficult case. And if it is actually very thick, so in that case, you need a lot of cartilages beneath the skin, so to try to hold the whole aperture together. So I try to gently touch the skin and pull that, try to see if the skin is thick or thin, and the thickness of the skin is really important before starting rhinoplasty. After that, I ask the patient about the breathing, about if there is any problem there or not, and if it is constant or it comes and goes. So if it is, gets worse during exercise, during sleep, or in the morning, it is really important. And also about the seasonal allergy. I try to block one passage of the nose and ask the patient for breathing. If there is a stuffy nose, then you will understand during this examination. After that, I try to check the quality of the cartilages. I try to check the thumb position on the nose tip, also try to check the thickness and quality of the lateral crura, try to check the clonal lobe position, and also the ANS during examination, or also try to check gently the thickness of the septum. So it is really important to have a good cartilage for harvesting the grafts, and if there is no good cartilage there, so you need to think about other donor sites such as the ear or ribs. So that is the very important step you should evaluate during examination. After that, I try to check the Cuttle maneuver or Cuttle test. It's a really simple test. I try to gently pull away and pull it to the side of the nasal bridge and ask the patient to breathe. So if breathing is better after this test, it shows that the collapse of the internal valve is the cause of the nose block. Also, there are some other tests. For example, modified Cuttle test. You can gently try to use a swab and try to hold that away. And by doing this, so you will understand if the cause of the nose block is the internal valve. So you can predict how to manage your rhinoplasty. For example, use the Streeter graft for widening of the nasal bridge and also widening the internal valve. So your breathing will be better after the surgery. After that, I use a speculum, try to check inside the nose, try to see if there is any septal deviation. Okay, so if there is a problem about the septum, so you should predict how to manage that deviation during the surgery. Also, I try to check the lining of the nose, if it is pale, if there is excessive mucus there, if there is a rhinitis, so this can suggest about the allergy. So it is really important to evaluate that before the surgery. And also I try to check with speculum about the septal perforation. It is really important. If the perforation is present, so you should try to check the size of the perforation, location of the perforation, and if there is any crusting there or bleeding or any visual during breathing. So you should know that it is difficult to manage, and managing the septal perforation is really important during the surgery. So these are very important steps. So you should go step by step, try to check the symmetry, the thickness of the skin, the quality of the cartilages, the septal deviation, septal perforation, and also lining of the nose. And after that, so you can start your rhinoplasty. A good and very complete examination before the surgery is essential, because that gives you the plan how to manage the patient and what are the chief components of the patient. For example, the nose hump, the septal deviation, breathing problems, all of them needs a very careful and very precise plan before starting rhinoplasty. Thank you for your attention.